Hi, my name is Steve Bernard. I'm coming to you today with a story about my experience in dealing with Dr. Amit Gupta and his team over the past, I think, almost 5 years. So I'll go ahead and give you a little history. Actually, in November of 2019, it was discovered that I had a tumor in my bladder. And I went to see a surgeon, and he operated. And then he called me into his office and he said that it is malignant and that he was not able to remove it all. And he said there may be a series of treatments that you would want to endure. But he said, from a standpoint of surgery, he said, I just don't think I can get it out. And he said, I'd prefer to refer you to another surgeon who happened to be Dr. Amit Gupta. And I said, okay, I'll go meet with him. So I did. And my wife and I went together, and I went with the concern, if you will, that I was going to have a radical cystectomy, which means removing the bladder and repiping the flow of urine into a bag that you wear on the outside. So I was not too excited about doing that. And so when I met with Dr. Gupta and we sat down and had our conversation initially, he said, look, there are several other steps that we can consider before we come to that point. So what happened then following that was I had 4 more surgeries. I had chemo and radiation therapy. I had immunotherapy. And at one point, Dr. Gupta reported that he was able to remove all of the tumor. And then what small amounts were left were treated through the radiation and chemo. And so I went in remission, I'd say probably sometime in 2021. And then periodically we would do follow-up tests like CT scans, the cystoscopy where the camera goes into the bladder, and blood work and what have you. So I think it went well. I felt well, by the way, almost the whole time I went through all this, other than being a little tired. And that was always an interesting conversation with Dr. Gupta because he wanted to make sure that while we were combating the cancer, at the same time, I was feeling okay. And I was. So for me, it was not a horrible experience at all. So in May of this year, of 2024, went in for my routine CT scan and then cystoscopy. And it appeared that there were some suspect tissues in my bladder, and Dr. Gupta did a biopsy, and we tested them, and that showed that the cancer, I think of a similar nature, had returned. Thankfully, it was in the early stages, and all through this time, my bladder wall, my muscle wall on my bladder, was never violated or compromised, if you will. And because if it is, then it allows the cancer to spread into the pelvis or wherever it decides to go. That didn't happen to me. So I went ahead and had another series of chemotherapy with Dr. Gupta and then immunotherapy with my oncologist, Dr. Scher. And I've just finished that. I think it went well. I didn't have any horrible experiences again. I guess my body must be getting used to it. And I think that all in all, I'm in a good place. I didn't expect to be where I'm at today, honestly, and yet I am. And all of the times that I've dealt with Dr. Gupta and his staff, I just wanted to say thanks, because they're very thoughtful, proficient, and I think caring. The other thing I think is important is I find that Dr. Gupta is very current as it relates to the latest and greatest methods of combating cancer of several types that affect the urologic system. So I feel like I'm in good hands, and that's, as I said, why I wanted to make a short video and say thanks to him and his team, and we'll pray for continued success here. So I guess I'll wrap it up there. Otherwise, I could talk quite a bit longer. Thank you all, and good luck.